Good day to you all. I am Dr. Faizal.
I'm Dr. Iqbal.
We are working as a team for Camry Hospitals and we are launching endoscopic spine surgery. We have the first time Bangalore keyhole endoscopic surgery. So, we'll just show you now today. First of all, we'll take this as the disc. Okay, the patient will be lying down on the table. Mugavandu, Kalagadevandu, flat, lying down. Patient will be awake. General anesthesia, local anesthesia, we will give local anesthesia to the back. On the side, we will do it from the side. Midline surgery, we will go from the side. Local anesthesia, we will give injections in the skin. Anesthesia, local anesthesia, then we will have a small needle. The needle, the diameter, 1.2 mm. So it's just 1.2 mm and inner diameter it is 1 mm in diameter. So it's just a small needle, so there is no tissue on the damage. We are not cutting any bones, we are not violating any tissues. Tissues we are cut. So this needle under local anesthesia, local kutta jagadalli, we will just put it into the skin. Suppose it goes into the skin and it enters the disc. We will remove the stillet. Stillet bandu takondu. Then the guide wire, this is 1 mm guide wire adu needle olagade hogtene. So this position computerized image intensifier check ಮಾಡ್ತೇನೆ. So we will know ಯಾವುದು disc ಅಲ್ಲಿ ಏದು position ಎಂದು we will decide. ಆಮೇಲೆ once the guide wire is inside we will take out the needle ತಗೊಳ್ತೇನೆ. ಆಮೇಲೆ we will have a dilator. So this is again very smooth pointed dilator. ಇದು tissue ಒಳಗಡೆ ಹೋಗುವಾಗ tissues ಕಟ್ ಆಗೋದಿಲ್ಲ, tissues just dilates it. So tissue damage no tissue damage in this surgery. So once that we confirm the position disc alli hege check ಮಾಡುವ ಮೇಲೆ there is a 1 mm diameter in this dilator. It's called the obturator. ಅದು through the guide wire it goes into the disc. ಆಮೇಲೆ again we will check the position under CM. ಈ ಟೈಮ್ ಎಲ್ಲ patient awake. We will talk to the patient ನೋವಿದೆ ಅಂತ ಹೇಳ್ತೇನೆ. We will again give a shot of injection local soon, and the patient will be under slight anesthesia, monitored anesthesia care ಹೇಳ್ತೇನೆ. So patient will be awake, responding to ನಮ್ಮ ಅವರ ಎಷ್ಟು ಕೇಳುವಾಗ ಅವ್ರ ನೋವಿದ್ರೆ ಹೇಳುವಾಗ ಅವ್ರಿಗೊಂದು ರೆಸ್ಪಾಂಡ್ ಆಗಲಿಕ್ಕೆ ಅಷ್ಟೇ anesthesia. So once the dilator is inside we will remove the guide wire. Guide wire ತಕೊಂಡು then there is the dilator diameter 6.9 mm. ಆಮೇಲೆ then this is called the cannula or the obturator cannula. ಒಳಗಡೆ diameter 7 mm and the outer diameter is just 8 mm. So skin alli just 8 mm incision ಬರ್ತದೆ. So less than even 1 cm 8 mm incision ಬರ್ತದೆ. ಅದಕ್ಕಾಗಿ and incision ಮಾಡಿದ್ಮೇಲೆ then this channel goes in through the obturator ಒಳಗಡೆ. Again position check ಮಾಡುವಾಗ obturator ತಗೊಂತೀನಿ. So now we are ready to go for the surgery. Once the position is confirmed, tube ಒಳಗಡೆ ಆಗುವಾಗ we can adjust the position. The tube inside upper side or lower side or midline we can adjust the position. ಆಮೇಲೆ we will take the scope. This is called the single portal single channel scope. This is all the instruments and scope it's all German made, precise instrumentation. So this gives 60 times magnification ಕೊಡ್ತೇನೆ. Once this scope is inside, this is called the PELD endoscope. ಆಮೇಲೆ we will connect this end to the camera to the magnifying camera, which we for 4K display alli ನೋಡ್ತೇನೆ. So we get a magnification of around 60 times tissues magnification 60. Once we are ready, confirm the channel, we go in with the tube inside. So this is the working portal and always this will be held. ಆಮೇಲೆ scope we will connect it to the camera. ಇದರಲ್ಲಿ water channels ಬರ್ತದೆ, saline irrigation ಬರ್ತದೆ. So to cool the tissue, to hydrate the tissue saline infusion ಹೋಗ್ತೇನೆ. ಆಮೇಲೆ then once we are ready, we are seeing everything under the camera. We are not looking into the patient, we are looking into the thing and doing the surgery. So it's just surgery 7 or 8 mm incision alli ಮಾಡ್ತೇನೆ. Then we have precise instruments for this. A lot of around 50 to 60 instruments are there, which this is called a grasper, which we can go inside. So once we see the whole thing, we see the tissues in the Sunday instruments. This is also 3 mm or 3.2 mm instruments, which are very sturdy but very thin. So these are all precisely made instruments imported from Germany. So this goes inside, ಒಳಗಡೆ ಹೋಗುವಾಗ then tissues ಬಂದು we will handle the tissues with the instrument. So we can pluck out the disc ಒಂದು bulge ಆಗ disc ಬಂದು just take it out. And we use different types of instruments. ಒಂದು grab ಮೇಲೆ grab ಮಾಡಲಿಕ್ಕೆ tissues annulus ಒಂದು cut ಮಾಡಲಿಕ್ಕೆ. So tough tissues ಒಂದು handಲಿಕ್ಕೆ it is really very strong instruments. ಆಮೇಲೆ in case some very strong bone is there, ಒಂದು canal stenosis, older patients ಒಂದು canal stenosis ಬರ್ತದೆ, ಅದಕ್ಕಾಗಿ we use it's called the endo burr, ಒಂದು battery operated burr ಆಗ connect ಮಾಡಿ then we go inside slowly burr off the tissues and dilate the thing. The basic science is ಒಂದು the disc ಬಂದು ಹೊರಗಡೆ ಬರುವಾಗ nerve tissues, nerves ಒಂದು compress ಆಗ್ತದೆ. Compression nerve compression ಒಂದು will just remove the only the part of the disc which is come out. ಹೊರಗಡೆ ಬಂದ್ರೆ ಡಿಸ್ಕ್ ಅಷ್ಟೇ ನಾವು ತೆಗ್ತೇವೆ, ಹೋಲ್ ಡಿಸ್ಕ್ ತಗೊಂಡಿರೋದಿಲ್ಲ. And we use special RF, it's called the radio frequency probes, which generates just radio frequency, not a electric current, radio frequency, which ಅದು ಒಂದು ಜಾಸ್ತಿ heat ಆಗೋದಿಲ್ಲ, tissues heat ಆಗೋದಿಲ್ಲ. Use this, it's a sterile instrument, so we're not opening it. Use this, connect it to a RF generator, then this also can go into the scope and we can cauterize the tissues, we can shrink the tissues, so the nerve is absolutely free. And it takes around 20 to 40 minutes for a simple disc and around 1 hour for a single level surgery. So the patient is awake while we are doing this. The operation ಮಾಡುವಾಗ patient ಮಾಡ್ತಾರೆ ಎಲ್ಲಿ ನೋವು ಬರ್ತದೆ, any current sensation in the leg. So the patient gives us feedback. Operation ಮಾಡುವಾಗ patients feedback ತರ್ತದೆ, ಸರ್ ಅಲ್ಲಿ ನೋವು ಇದೆ, ಇಲ್ಲಿ current ಬರ್ತದೆ. So we know which tissues to remove. We just don't go inside and blindly remove the tissues. We talk to the patients, we palpate the tissues which are causing pain. Pain ಬರುವಾಗ patient ಹೇಳ್ತಾನೆ, ಸರ್ ಮುಂಚೆ ಇಂಥ ಪೇನಿಗೆ ಇದೆ ಕಾಲಲ್ಲಿ ಲೆಗ್ಗಲ್ಲಿ ಬರ್ತದೆ ಅಂತ ಹೇಳುವಾಗ ಆ ಟಿಶ್ಯೂಸ್ ನಮಗೆ ಗೊತ್ತಾಗ್ತದೆ, ಆ ಟಿಶ್ಯೂಸ್ ಪ್ರಶ್ನೆ ಇದೆ, ಅದಷ್ಟೇ ತಗೊಂಡು we use RF and other instruments to remove it. And at the end of the surgery, scope ತಗೊಂಡು remove ಮಾಡ್ತೇನೆ, remove the tissues, and this wound, that is 8 mm wound, just seal it with the skin glue. So there is no stitch in that, hardly any scar, especially for young females who are unmarried, people who don't want any big scar in the thing, and moreover they don't want any wound to heal. Stitches illa, tissues cut agudilla, bone remove madudilla. So the tissue just heals in 7 days. 10-day patient is back to his normal routine. So just around 1 to 2 weeks of rest. Normal office ಕೆಲಸ ಮಾಡುವಾಗ they can get back to their work within a week or so. So ಸ್ವಲ್ಪ ಜಾಸ್ತಿ rest ಬರುವಾಗ we hardly allow them to take rest for 3 weeks. So like people who are drivers and all, we give them up to 3 weeks of rest and they can get back to their work at the earliest. In the open surgery at least 3 months rest ಕೊಡ್ತೀನಿ. So even in this we can do fixations, screw fixations, it's called stabilization. ಮುಂಚೆ ಎಲ್ಲ we have to open up, put screws through the open procedure. So under the computer imaging we can put endo screws also, which done through very small incision, and that too under local anesthesia. So the fancy of this surgery, patient awake ಆಗ್ತದೆ, recovery time ಇದ್ರೆ just 24 hours. Patient ICU care ಇಲ್ವಾ, no need of any urinary drainage. Patient can pass the urine within an hour, go to the loo and pass it, have food within 1 hour. So as simple as that. So we are trying to reduce the risks to the patient, improve the patient's recovery time, and save their money as a lot of hospital stay and out of work. So let's hope that this brings a lot of hope and recovery to the people of Bangalore. Thank you so much. Thank you. Thank you.
Asking him we are doing on this.
We'll just give small tap.
Okay. Don't worry, all pain which you can afford to. Small pain.
Mild.
Repeat. Pain?
Little.
Little. Sure.
You're fine?
Yeah, I am fine.
Okay.
Sure.
Injection? Sure.
Okay. So go ahead.
Show Ibra. Show. Show. വീട്ടിലായിരുന്നോ നേരത്തെ കുറച്ച്? Lights off.
Starting. Okay.
Yeah, everything done.
Rotate it. One more. Okay. Is there any pain in the leg now?
No, there's pain.
Okay. I'm just pressing on the leg right now. My doctor is pressing on the ankle before surgery. Just tell me how the pain is.
1 minute.
Exactly at the point where I press before surgery. Is there a pain now?
No, pain from hand.
Only from the hand? There is no pain which was there previously. Gone?
No.
Okay.
No,
Eating too much, so that's the same thing here. Don't worry.
okay.
Nabil,
Yes.
the pain which you had earlier, now is the pain better?
Yeah,
The leg?
better. Yeah.
Yeah.
I feel too much better than before.
Okay.
Yeah.
Okay.
The surgery. How do you feel? My assistant is closing the procedure.
Yeah, now better.
Now better. So I was just describing in the MRI. I'll send you the videos of that.
Thank you.
Okay, so you can go through and see what we have done.
Thank you.
Inshallah.
you.
You're okay?
Yeah.
So keep good. Thank you.
Thank you for all the stuff, doctor.
Nabil, how was the experience? Is this your first surgery?
Yeah. Now I feel better.
You feel better.
Yeah.
You didn't have any pain at all.
No.
Thank you.
Thank you.
Okay, take rest.
Okay, thank you.
Okay.